Hi everybody, this is Dr. Rina, consultant diabetologist at SIMS Hospital, Vadapalani, Chennai. On behalf of She Clinic, we will be focusing more on women's health and wellness. So moving on to the topic, today we will be discussing about gestational diabetes, that is diabetes during pregnancy. So gestational diabetes is a condition in which there's high blood sugar levels during pregnancy when the body of the expecting mother does not secrete enough insulin during pregnancy. So if you look at the stats, it's around 1 in 4 pregnant women who end up having diabetes. But the most shocking thing is that 70% of them remain undiagnosed. How diabetes occurs during pregnancy, what are the high risk, and how can we prevent GDM? So moving on to the high risk factors of gestational diabetes, it's either the previous history of diabetes of the mother and she's delivered a big baby during that time, or she's having an overweight obesity of BMI more than 30, or polycystic ovarian disease, or if her age of conception is more than 35 years, or if there's a genetic predisposition, which is a strong family history of diabetes which run. Now moving on to the detection of gestational diabetes, normally gestational diabetes occurs typically during around 5th month, that is around 20 to 22 weeks. We normally do an oral glucose tolerance test where we detect the glycemic status of the women. But if the mother or the patient is earlierly diagnosed diabetes or is in high risk, we normally do this test much earlier, around 8 to 10 weeks, to detect GDM much earlier. By this, we detect gestational diabetes at the earliest and give appropriate treatment to prevent any risk factors. So moving on to the detection part, as I told you, oral glucose tolerance test is like 75 grams of glucose we normally give them at the earliest, and if any one of the values also shows any abnormalities, we recommend to treat this treatment much earlier according to the protocols. Now the most commonly asked is how is my baby going to get affected. That's the most question asked by every mother. So once the sugar levels are very high, and an uncontrolled GDM mother delivers a very high weight baby, around 4 to 5 kgs, leading to more C-sections in the pregnancy. And there can be high incidence of jaundice also, and the child also can be born with hypoglycemia, that is low sugar levels during birth. If you look at if the GDM is untreated, normally they'll end up having miscarriages, congenital abnormalities, and even premature birth. So moving on to the mother's complications, we normally ask them to do a glucose test. Apart from that, we ask them to check the self-monitoring of blood glucose at home with a basic glucometer. And nowadays we have a recent technique of sensor patches which we apply normally in the left arm, so that we can continuously check the blood sugars if they are uncontrolled. So now coming on to the treatment part. So a healthy lifestyle is very important. So once we have detected, we need to have a customized diet and exercise plan for each and every woman, as every woman is very special, and presenting pregnant women requirements also are different. So a customized diet and exercise plan we advise at She Clinic, and we also ask them to monitor the blood sugars levels every day with a glucometer and update them. And if these are all controlled and we have a very good monitoring of blood sugars, we can prevent all these risks. So I think most of the things I've covered in gestational diabetes. If still you have any doubts, you can just contact us at the SIMS She Clinic website. Thank you.